Click on live. Wait for this to load.
Is it live?
Alrighty, I think we are live.
Yes.
All right. Good evening, everyone. I hope you're doing well. Thank you for joining us for part 2 of our discussion with Dr. Kindred. Tonight, we're going to be talking about hair loss in the Black community. Why do Black women experience hair loss? What are some action steps you can take if you are experiencing hair thinning or hair loss? I am excited to get this conversation started. Once again, my name is Bria Gadsden, one of the co-founders of Love Your Menses, and I will allow my other co-founder, Dr. Aberi, to introduce herself.
Thank you, Bria. Thank you, our Facebook attendees. Thank you so much for joining us today for the second series of our ABCs of EDCs. Again, thank you, Dr. Kindred, for coming. My name is Dr. Azuma. I'm the co-founder of Love Your Menses. If you don't know our organization, you kind of should. Check us out on our webpage, www.loveyourmenses.com. Thank you again for joining us. Again, I am a board certified OBGYN, and I'm excited to bring this community education. Please comment in the chat box with any question you have, because this is for you. We want you to be educated. We want you to be well informed. Thank you. I'll hand it back to Bria.
Thank you so much, Dr. Azuma. So glad to have you here. I'm briefly going to allow Irvine to introduce herself.
Hi, I'm Irvine from ABCD and a fan of Love Your Menses organization. We are kindred and doing a lot together. And as I said earlier, I love the first session, and I use my privilege to get on the Zoom. So that's why I'm here, and I appreciate that.
Awesome. Thank you so much, Irvine. So excited to have you here. And lastly, I definitely want to introduce Dr. Kindred, our guest speaker for today. Dr. Kindred, how you doing? How are things going?
Good. Hi, everybody. It's good to see you all again. Thank you guys for having me. I had so much fun with you all last time that I'm looking forward to tonight. Doing good.
Awesome. Thank you so much, Dr. Kindred. So I definitely want to jump into the conversation. So starting with first, Dr. Kindred, we know you are the owner of Kindred Hair and Skin Center. So what made you decide to specialize in providing hair treatment services, and what specific services do you provide?
Okay. So in regards to what made me specialize in hair loss, I have to admit, I literally had no intentions. I remember saying, I'm not going to specialize in hair loss because there's no quick fix, right? You come with a skin cancer, I cut it out. You walk out without the skin cancer, I cured you. That's not the case for hair loss. It's the reason why a lot of my colleagues don't specialize in hair loss, even though we are the hair experts. It's like our version of diabetes. It's the one thing we can't fix. And at the time, there were not a lot of good treatment options. So the reason why I ended up specializing in it, even though I had no intentions, is that my training at Howard University in their department of dermatology, when I came out to Baltimore, it was like light years ahead of what the patients were getting, and the patients recognized it. And I just felt like I amassed all of these hair loss patients. Now in the Black community, dermatology simply wasn't, we didn't have access to it, right? So the hair loss experts were the stylists since forever. And that's unfair because it's a medical diagnosis and needs a medical intervention, but that burden was laid on stylists. So I was getting patients way too late in the game. So a girlfriend of mine, Yolanda Lindsay, started a program where she gave workshops to hairstylists. And so we brought that to Baltimore and I started giving workshops to hairstylists. What was great, I was getting patients earlier. and I can make a better impact. So I had to decide, do I want to stick with what insurance covers, which isn't sufficient, or try to offer everything that's out there? And it worked okay, but I knew I had to open up my own practice to really stay on the cutting edge. So I opened my own practice, and now I offer stuff that I probably offer more, if not more than 95% of other dermatologists. It's probably close. So when you come in, it's first just a hair loss consultation. I'm whipping out none of our fancy toys, right? I'm literally whipping out a pen and a piece of paper. That's all you get. But it's a very thorough one. I want to know hairstyling practices. Did you have a relaxer or not? Does it run in your family? Do you have tenderness? Is it severe? How's it affecting your life? And then I walk you through the disease process. We go over all of the treatments and the side effects, etc. Then we do a biopsy. 90% of our patients get a biopsy because, well, for a lot of reasons. One is not every Black woman with thinning edges is from wearing tight ponytails, weaves, and braids. That's number one. Number two, and we'll go over this later, not every Black woman who has thinning on the top of the hair is a condition called CCCA. There's always exceptions to the rules. Now, after you have your biopsy, that's when it really gets going. So if you have inflammation, we do things to get the inflammation under control. Sometimes it's injections. Once inflammation is under control, we move over to what we call the repair phase. Now that's the fun part. That's the part that patients are like waiting to get to. And that's because we use growth factors. So give me a second to explain growth factors. Growth factors are chemicals in the body that just heal stuff, right? You cut yourself, it heals it. If a cleft lip, growth factors help to repair it after the surgeon repairs it. Growth factors are thebomb.com. So let me give you a practical example. When you cut yourself, you don't bleed to death, and that's because your platelets form the scab. The reason why you don't require all of your scabs for the rest of your life is because those same platelets, when it was forming the scab, was releasing chemicals to trigger the healing process. So that way, when the scab falls off, the skin underneath is healed. The chemicals that it released were growth factors. There's three ways that we offer growth factors. One is platelet-rich plasma, PRP. And literally, we draw your blood, we extract your platelets, we activate it, we inject it into areas of hair loss, and it releases growth factors. We've been doing that for 5 years. We have about 1,000 patients or cases that we've done. But I do have 7 patients that did not have a good outcome. So it's not 100%, but it's pretty darn close. But there's a problem with that. One is I'm limited to the amount of plasma that we're able to extract. So if you have a large area, I try to spread it out so you're not getting a full dose in any one section. If you have a platelet disease, a bleeding disorder, if you're on medications that impair your platelets, it's not an option. And then some people are scared of needles. So while 90% of my patients who needed PRP was able to get it, I have such a large volume that 10% for me is a lot of people. Technology is advanced. Growth factors can now be made in a lab. That changed the game, you guys. It changed the game. I can't tell you how much. So PRP is cutting edge for some people. That's actually old for our practice. Again, we've been doing it for years. What we do now is 2 things. One, we run a laser over the scalp. And what it does, it creates little microscopic channels. So instead of keeping everything out, which is the skin's job, it acts like a sponge and it absorbs everything in. Then we take the growth factors from the lab and just massage it in. I'm not worried about what your platelets are doing and if they're coming with their A game that day. I'm not worried about what medications you're taking. I'm not worried about you being scared of needles or anything. And the growth factors from the lab, it includes the growth factors in the platelets and all the other growth factors that make hair grow. And the concentration is 1,500 times more concentrated than normal. So it's probably not surprising if I tell you, we're seeing better results with that than with PRP, and PRP is great. And then we do there's one other option where we do a deep cleansing. So we literally suction out all the gunk out of the hair. And you can see this stuff floating in the water. It's hair products, especially for people that still co-wash and don't know better. We get yeast and dead skin and oil. It comes out. Now you have a nice, clean, empty pore. We squirt growth factors in. So growth factors are really the stage that you want to get to in a hair loss journey. And we offer all three. And then the last thing we offer, okay, the second to last thing that we offer, maybe you should have asked me about what we offer for hair, is hair transplantation. So again, sometimes I don't catch a patient early enough. There's no root for me to grow a plant from. I need a root to grow a hair. And we literally have to take a normal follicle and just fill it in where it's needed. The last thing that we offer is we're the only, not the only, at least the first, dermatology practice with a full service natural hair salon in the office. And I absolutely consider what the natural hairstylist does to be a part of the treatment regimen for the patient. I'm gonna stop right there. I thought of one more thing, but I'm gonna just stop. That was a lot as far as what we offer. But that's the gist of what we offer for our hair loss patients.
Wow, this is so amazing. Thank you so much for summarizing the various forms of treatment. But, you know, I'm going to go with a patient's perspective, someone that is new, someone that doesn't know what PRP is, like I did it until you said it. But let's say, can you summarize like the 3 causes of hair loss in women? I want to focus on women for now, and then we can, if we have time, we can talk about male pattern hair loss, but we talk about for females. What would you say are like the 3 causes of hair loss in the Black community?
Okay, so if we look at all 15 or so forms of hair loss,
yes,
add those up, it still doesn't amount to the number of Black women suffering from CCCA. CCCA stands for central, because it likes to start at the center of the scalp. Centrifugal, because it starts small and then it spreads. Cicatricial, meaning it leads to permanent scarring. And alopecia means hair loss. CCCA. Every hairstylist needs to know this, what this diagnosis is, because it's one of the ones that is relentless. It's caused by a gene, the PADI3 gene, the PADI3 gene. And with that one, the follicle is made incorrectly. The immune system recognizes something was made incorrectly, and so it destroys it. The problem is the hair falls out in the process. So CCCA is by far number 1. The second one is female or male pattern hair loss. That's just where our own testosterone is betraying us, and it's miniaturizing hair follicles. So for those of you with irregular periods, facial hair, increased sweating, deepening of the voice, cysts on your ovaries, difficulty getting pregnant, hormonal acne, right? I just described PCOS, or polycystic ovarian syndrome. Yeah. You're prone to female or male pattern hair loss. And then the third form, the most common form that I see is our fault, and that's traction alopecia. That's from tension. And our culture is way too obsessed with neat edges to where we are literally creating a form of hair loss that is unnecessary. We got to get away from neat edges. It is not that serious. And that's basically, we're literally ripping our hair out of the scalp. Now, if it's not too bad or if it's not too often, it'll grow back. But all you need is one really severe time or something that you're doing repeatedly, and it'll cause traction alopecia that goes from reversible to permanent. So CCCA, female pattern hair loss, and traction alopecia.
Awesome, thank you. And since we're on the topic of laying down your edges, you know, I've always done that since I was young, as a teenager, with my gel and my edge control, have my little brush. However, now that I'm older, I realize, well, one, I'm putting my chemical directly on my forehead. Like, is that seeping into my skin? Is it affecting my hormones? And so what are your thoughts on gels and edge controls? Do you think, are there safe products people can buy to lay their edges? Or do you just recommend, girl, don't even lay your edges, just leave them as is and go about your day?
you touched on two really important topics. One is ingredients, right? While we want to look fly, we still got to stay healthy, and we have to pay attention to the ingredients. So you want to go like as natural as possible. So all of these small, independent companies that are coming out with products, those are usually the way to go, right? They're seeing that we don't want, I want to list them all, but all of the chemicals that are available, and most of the time you won't even know it because it'll just say fragrance, right? So you're right to pay attention to ingredients, but as far as their edges, if you do it every day and keep putting your edges in the same direction, whatever direction that is, you're going to induce traction alopecia. If you want to do it for a special occasion or something like that, then go for it. What I think needs to happen is that those of us that are in positions of power, right? Those of us that are before audiences, that are CEOs or business owners, that are teachers or whatever, I truly believe we need to intentionally not have our edges straight, right? Not have a relaxer, so that we can show this younger generation, you can be a beast with the hair the way it grows out of your head. And I think that's because we're still a little bit too obsessed with neat edges. It's the reason why I intentionally, no, right? Yeah, look, y'all see my little nappy naps clipper in there, right? And I can tell you it's intentional, right? So my hair is about, I don't know if you can see it, it's about this long. I intentionally don't wear it straight anymore because of the position I'm in and the number of mentees I have and all that kind of stuff. So a special occasion every so often, no problem. Every day, you become my patient and I'm treating your hair loss.
All right, thank you. My next question is about CCA. What is the age of diagnosis? And while you're answering that, you talked about how sometimes people come to you when it's too late. So what is early intervention? What is that?
Really good point. So the earliest I've ever seen it is in a teenage boy who was in high school. Okay, and it was just heartbreaking for him. However, the earliest published biopsy proven CCCA was in a 6-year-old.
Wow.
So that was our hint that it's genetic. And so I'll admit, it used to be a lot of victim blaming. It was because Black women were hot combing their hair. Then everyone switched to relaxing. They're like, oh, it's caused by relaxers. And then that wasn't making sense. And they said, oh, it's because your mama put braids in your hair. It was all this mess that was out there. So we know it's caused by a gene. So now we're not surprised to know that, yes, we have it all along. I've known I've had it since I was 25. I had a biopsy by Dr. Valerie Callender in Maryland. So you have it, but it shows up usually about our 20s. And what that'll feel like, usually you can feel it before you know it, you have it. So have you seen women who just walk around and they just pat right here in their head? They say it's itchy, but the patting feels better, usually because of that perception. They're able to perceive inflammation. But usually there's no hair loss at that point. Another early stage is when it's what stylists call a sweet spot, right? Because again, stylists were the experts before they were letting Blacks into dermatology. So they've been seeing this all along. Now we just have the science to back up what they've been seeing. And what happens is there'll be a normally short zone of hairs, right? Where the hair just won't grow as long or as fast as it used to. That's called CCCA form for us. The third early way because it's not cookie cutter, it's not going to be the same way in every single person. The third way that it's early is it'll seem like the part is starting to get wider and wider and wider. And sometimes it's in the center and it moves back, or it's in the center and moves forward. Those are the 3 early ways. And I say there's no reason, if you even suspect it, to see a dermatologist that specializes in hair loss. think that, yeah, so that answered both questions.
Awesome. Thank you. And so, since we're on the topic of hairstylists, what do you think hairstylists can do to help, their client prevent reaching that late stage when they're experiencing hair loss? Like, what are some things hairstylists can do? Because no, they're not dermatologists. However, if they're, working with the same client for years, and they can notice these early signs. And so how can we utilize our hairstylists as those early prevention specialists?
Yes. Hairstylists are so key, particularly in the Black community when it comes to hair loss. They might be the most important one, actually, because they usually see it first. And a good hairstylist can see signs of hair loss before even the patient knows they have hair loss. Okay. So if it's something like alopecia areata, that's where you get little round areas of baldness. It usually goes away, but if they find that it's not improving within 6 months or so, they can send it to a dermatologist. We want to get blood work anyway because it's autoimmune. If it's ringworm, we need them to send it to dermatologists because once it's in the hair, we need pills. If it's CCCA, I guess I'm gonna keep saying over and over again, send it to a dermatologist, right? Once it's a medical diagnosis, that hairstylist can make or break how well the patient responds because they determine how early a patient comes in. Data shows that when the patient comes to us, because the patient decided to come to us, they've lost a ton of hair. But when the hairstylist sends the patient to the dermatologist, we catch the patients earlier and we can make a huge difference. So the key is for the stylist to recognize there's something wrong and recognize when to send it to dermatologist. Now, there's other diagnoses. So traction alopecia, they should be training the patient on how to have hairstyles that don't put so much tension on the hair. So that's for my braiders, that's for my locticians, even my patients with sister locks. That hairstylist makes a huge difference. When it comes to, it's called trichorexis nodosa, and that's when there's breakage on the hair or split ends or the hair is brittle. The stylist needs to know when to use a steamer to hydrate the hair because our hair can get dried out just like the skin, which products to use, when a deep conditioner, but stylists are usually spot on when it comes to that. I need the stylist to recognize traction alopecia and eliminate those hairstyles right away. Finally, once the patient after they sent them to a dermatologist, I'm not doing their hair, right? I still need the hairstylist to take care of the wellness part. So sometimes it's difficult for me to convince a patient who has CCCA, sis, you need to get rid of the relaxers, making it worse. Some of my colleagues will say, oh, just don't do it as often, reduce the frequency. But like in my office, we are anal when it comes to hair, the health of the hair and the scalp and wellness. So we are literally telling our patients, I need you to get rid of the relaxer. The hairstylist helps us to do so. We do consider hairstylist partners in helping our patients get across the finish line, but part of that is our responsibility on teaching hairstylists how to recognize certain things. And the most important thing a stylist can do is not delay the essential medical intervention that the patient needs once they have a medical diagnosis.
Wow, very good points. I appreciate it. My take-home point there are many, but I like what you talked about, looking fly but healthy. I think that's really, really cool. So thank you with that. With that said, I know, yes, there's some licensed and certified hairstylists that were trained, right, to recognize hair loss and when to repair. But like some of our Facebook fans and attendees watching us right now do not go to a licensed hairstylist, right? Because, maybe their sister knows how to do it, which, we recommend going to a specialist. But at this point, let's speak to that girl that just taught how to braid hair and is braiding everyone's hair. How do you know to send a patient or her client to a dermatologist, how would she recognize?
Okay, excellent.
Simple tips like, you know,
Yeah.
regular hairstylists that did not get formal training.
Okay, good. I thought you were about to mention trichologists. I was like, oh Lord, here we go. All right, so for yes, right, because a lot of us know how to do hair. Well, I don't know how to do hair, but a lot of us know how to do hair and don't necessarily need to go to the salon. But you're still on the front lines, right? You still have that responsibility to the person whose hair you're doing. So as braiders will probably pick this up faster than anybody, because braiders have become perfectionists at knowing how to place a braid so it hides a bald spot, right?
Mhm.
So yes, please still hide that bald spot while you telling sis to go to the dermatologist. And what that would look like is the part is getting wider, right? And you guys are, especially braided, you guys are so on point with parts. I know you recognize when a part is getting wide. And if it's here, some people just have a natural triangle, right? I'll give you that one. But if it's anywhere else and the part's getting wider, that's all you need to know. I'll do the rest, right? The other thing is if you find like there's hairs where the growth is stunted, where it shouldn't be stunted. Sometimes the hairs are just a little bit shorter naturally along the front or in the back, but it shouldn't be a random patch of hair where the growth is just smaller. You guys can recognize that. Locticians, first off, is anyone come and says that a lock fell out, right? Like before they sit down in your chair, you should be giving them like a dermatologist card. But what you also notice, you find that a lock is getting really skinny. It's really skinny at the root and then it gets thicker. It's supposed to be the other way around, right? It's supposed to be thicker here and then it gets thinner towards the end. So if that reverses, that's your other sign, because the advantage you don't have is with locks is you don't see the shedding. A hair that shed is incorporated with the locks. That's why it looks so long. So you're going to have to go by the density, the thickness, the width of the lock, right? And I just explained all of that without any medical terms. This is stuff we're already seeing. We already know. It's just now we have some medical terms attached to it. So yeah, you don't have to be licensed to see that a part is widening, the growth is stunted, or a lock is skinny at the roots.
To follow up on Dr. Iber's question, I think about all of the folks who are like creating their own products in the kitchen. You know, what do you say to those folks in terms of the kinds of, you know, the recipes they're using and the kind of, you know, the kind of ingredients?
So if the products in the stores were safe, I would be hating on all the kitchen products makers. But I don't blame them one bit. So I just try to give guidelines, because I think if something groundbreaking comes out, it's going to be from one of us doing something in our kitchen. So I say avoid olive oil. That first off, not everything natural is safe.
Right.
I do want to get right, and like I do want to like let you guys know that just because it's natural doesn't mean it's safe, and just because it's a chemical doesn't mean it's dangerous, right? So I'm not concerned, honestly, if it's natural or unnatural. I'm concerned if it's toxic or non-toxic. That's first and foremost. Now, pushing that aside, olive oil feeds the yeast that causes dandruff. So don't put olive oil on the scalp, okay? Everything that they say grows hair doesn't. So don't think you're coming up with some root stimulating, whatever term they're using. What does work is rosemary oil, right? So if you put rosemary oil and a couple of other things, then okay. The other thing is avoid acids. I'm seeing too many acids put in products, lemon juice and there's something else. And I was like, why? The other thing is apple cider vinegar does not cure everything. It does kill yeast and fungi. However, you're not just treating the scalp, you're also treating our hair. And our hair is actually pretty delicate. So I don't want anything that's too much of an acid, lemon juice, or too much of a base, vinegar, in what you're making. So go for it. Do not consider Googling something to be research. First off, that's an insult. because you Google it, that does not count as medical research at least. But I do want you to look into the properties of your ingredients and then go from there. Know what you're working with, and then move forward. Chances are whatever it is your grandma made for her and her sister's hair probably is legit, believe it or not. So start there and then start adding stuff.
Thank you. I'm thinking of like, we need a grant, right, to go through and like do the education in terms of, you know, the hairstylist and all of that to get the information out. The other thing I think about too is, you know, we as folks of color have a really challenged history with the medical profession and research. And, you know, one of the things that I got excited about meeting you is the fact that here are folks who are doing research, right? And a lot of times we don't benefit from the research that exists because we are, you know, and rightly so, right? We have that history, right? And so we don't benefit from a lot of the research that happens because we just have a distrust of science and medicine and research because of the way that we've been treated. And so, you know, and our access to the medical system, right? So like, at what age do we as Black folks even become aware that we have a dermatologist, and that's even, never mind Black dermatologist, but you know, that's a doc that we can, you know, a specialty that we can access, and even, you know, and is it offered to us?
Oh, Lord, help me. About to give me my soapbox and I can't help it. It's about to be on and pop. And listen here, that is well-deserved mistrust, right? It's not like something happened and then we blew it out of proportion. Not only that, we don't remember Tuskegee. My generation, we read about it in a book along with everything else. The fact that we still have mistrust in 2020 is because it's still happening, right?
Exactly.
It's not like, oh, we were so traumatized and we can't get over it. We're still experiencing it. Why is it that our babies are 3 times more likely to die if the OBGYN is not Black? Yeah. Nothing to do with Tuskegee. And our babies did nothing wrong in the world. If your doctor's on Black, studies show you die earlier. Nothing to do with Tuskegee. So there's like this well-earned mistrust that my medical community, my colleagues, we have got to correct. We have to correct. So, and that does fall into research. And right now they can do research in general, hardly include any Blacks, and then tell doctors, go prescribe this to Americans, including Blacks. The whole point of the research is so that we know how it's going to play out when we prescribe it for our patients or when we perform the procedure for our patients. Worse, they take diseases where Blacks carry the burden, study it in mostly whites, and then give it to us to treat patients, right? At least if we carry the burden, include us in the research. So what I'm doing is I'm creating a pipeline, at least for dermatology, and NMA as a whole is doing it too. Well, let me back up. NMA is National Medical Association. That's the national organization for Black doctors. I'm the chair of the dermatology section. None of what I'm saying is on behalf of NMA, because I get a little controversial sometimes. But basically what we're doing is we're creating a pipeline so that when industry is ready to do research on something, they can come straight to the dermatologists whose practices look like America, right? So yes, come to me because I have a ton of Black patients, but I have white patients, Pakistani patients, Hindi patients, Hawaiian patients, Polynesian, like I have the full rainbow of Americans in my practice. Now, one, my patients know, like my patients come first. They're not going to be done wrong. We already have a trust built in. So if something goes sideways, I got their back. Number two is so long as we ask physicians or researchers who are not treating Blacks to run the studies, it's garbage in, garbage out, or I should say, you get out what you put in. Yeah. The studies are not going to have us. So if for those of you that are looking for a Black dermatologist, I recommend go to blackdermdirectory.com. As far as what age do you need to see a dermatologist, we do not get skin cancers like our Caucasian patients do, right? So for my white patients, I want to start doing your skin checks every year by the time you're 30, maybe 40. Skin cancers, we need to increase skin cancer awareness, but doing a skin check every year is super inefficient for skin cancer. So for Black patients, if you have a hair, skin, or nail problem, that's the age you come to dermatology, right? So my kids, it's usually eczema or warts or molluscum. For my 20-year-olds, if they're Black, it's usually a disease called HS. We talked about it last time. Hidradenitis suppurativa. Start getting a little bit older, it's hair loss. So for Blacks, see a dermatologist if you have an issue. For whites, I need to see you regardless, so I can start doing your skin cancer screenings. And then everybody else is kind of in between. So, because I know you hit on both points, like the well-deserved mistrust for research, and then at what age should Blacks be coming in to see a dermatologist? I feel it's our responsibility as dermatologists to educate Blacks on what to look for in a skin cancer and when to come in. But I'm not going to take what evidence shows works for whites does not work for Blacks and still tell Blacks to do it, which is saying come in every year for a skin check. If you want to, come in, but I'm not going to tell you that's going to prevent your skin cancer.
Right.
Mm-hmm.
Thank you.
Thank you, Dr. Kindred. I agree with Irvine. I think we need to get a grant going to educate hairstylists and other people who do hair in the community on how to spot these early signs. My next question for you is, so a lot of people I've been talking to who have given birth always say they experience hair loss or thinning after giving birth. So is this a thing, and what is causing the hair loss after someone gives birth?
So what they're referring to is called telogen effluvium, T-E-L-O-G-E-N, effluvium, E-F-F-L-U-V-I-M. And that's just, there's a shock through your system and it caused the hair loss. We can see this with bad diets, surgeries, severe illnesses, and too rapid of weight loss and malnutrition. But let's talk about after the babies. What happens while you're pregnant, it's a lot going on, right? You're literally growing a person. Your body's like, look, hair, you stay right there. Just keep growing. I'm gonna come back to you, right? And that's when you get hair looking like Jessica Rabbit, right? And then after the baby is born and your body is starting to recalibrate, it comes back, okay, hair, all of y'all that was supposed to shed over the last 10 months, go, right? And then you just see all this hair loss that's happening. It can be really scary. It's always less than 50% of your hair that comes out though. And it usually is back to normal by the time the baby is 2, usually by the time the baby is 1, honestly. So you can exhale at that point. However, there's 2 things we need to point out. 1, that's telling us that you have a legit bona fide form of hair loss coming down the pipeline. We don't know if it's in 2 years or 20 years, but you're gonna have it. Because just about every single one of my patients with hair loss, and again, we biopsy everybody, so it's not like it's self-perceived hair loss. Like we literally know it's hair loss. When they were pregnant, they recall when the baby was 3 to 6 months old, they had some shedding, but it came back. That's one scenario. The second scenario is that you had a little bit of hair loss already. It was mild. It wasn't a big deal. You had telogen effluvium and it unmasked it. And now you feel like you never recovered from the hair loss from the baby. Well, yeah, the telogen came and went, but that form of hair loss, CCCA or female pattern, now is acting a daggone fool. So it's usually one of those 2 scenarios. It is a thing. It's telogen effluvium.
Wow. Quickly, Barry, just to follow up, since we're talking about childbirth, one thing I always see is certain people will put the barrettes in their baby's hair and make these tiny, tight little ponytails. How do you feel about styling baby's hair as, you know, as young as 1 or 2 years old?
So
Do
I
you
think
think
that's
that can affect
actually
their hair?
one of the most unfair things we can do, because traction alopecia, one, is preventable. Two, it's reversible. But sometimes we're so obsessed with those neat edges, as we mentioned, that the baby ends up developing traction alopecia that's irreversible. Now, forever, they're going to have issue with hair loss on her edges, right? So it doesn't have to be tight, whatever you do. So usually what I recommend is just have a braid, you know, a French braid at the front, leave the edges alone, do whatever it is you want with the rest. The other thing is oh God, it just makes me sick. I've seen 1, 2, 3-year-olds with braids with extensions added to it. Leave that baby hair alone. It's okay to just have the afro out and one barrette in the front, right? And it's not tight. So yes, still put hair in ponytails, braid it, do everything that is culturally appropriate. It just does not have to be so tight that we're creating a form of hair loss in that baby. You can still do it and stay healthy.
Wow, excellent point. Thank you again for that. So for telogen effluvium, you've given me a take home here. So if my patient is losing a lot of hair, I should tell her to be aware that she might be at risk for future hair loss, and give her signs or set points when she needs to seek a dermatological consult, correct? Okay.
Perfect. Yes.
Okay. So my subsequent question to that is, I know your thoughts, but there's some people here that don't know you or are not in medicine. What are your thoughts on chemical relaxers, Brazilian blowout, straightening combs, and other hairstyling methods? I know you touched on it, but we want you to formally tell us what your thoughts are.
Oh, absolutely. Okay, so I'm gonna start first by talking about just wellness, right? So most Brazilian blowouts, even the one that deny it, has formaldehyde, and I do not want you guys exposed to formaldehyde like that, period. Then for relaxers, we are finding the chemicals in relaxers in the urine of Black women. To show up in your urine, it had to go through your kidneys. To get to your kidneys, that means it went through your blood. If it went through your blood, it went throughout your whole body. And that's just from that. Oh my gosh, I haven't had a relaxer since I think I was 15. So I don't remember how long they even keep relaxers on now. Whatever amount of time the relaxer is on, that's the amount of time, that's all it took for it to go throughout your whole system. And you do not want those chemicals in your body because they start to behave like hormones in your body, right? So, and hormones can determine whether you develop fibroids or not, or whether you are infertile or not, or whether you develop breast cancer or not. And we can't do legitimate studies in it because there's no way we're going to infuse phthalates and other chemicals in a woman to see what happens. That's unethical. So when we do these population studies, we look at a group that has had relaxers and look at a group that doesn't. The one that has relaxer has a whole lot more diseases than the other group, even if they're the same age, same race, same wealth, same education. Now that's just from the wellness part, right? The other part is if you have CCCA, I can say from my experience, 100%, it worsens CCCA. I've seen patients who got rid of their relaxer, still straighten their hair with flat irons and hot combs, and their hair did better. It's something about the relaxer. My guess is it activates the genes or it triggers an inflammatory cascade where it's worsening CCCA. I don't see it worsening some of the other forms of alopecia, some of the other forms of hair loss. So it's something about Black hair. The more we leave it alone, the better it is. And I just want to point out that because your mom or grandmother got away with it doesn't mean that you can. What we're seeing is in certain forms of hair loss, and especially CCCA, with each generation, it gets worse. So, and your grandmother, maybe her hair was full until she was 70. Your mom didn't start thinning into their 50s, and you nearly bald headed in your 30s. It's getting worse with each generation. So I say, don't even play with it. Just start off by doing the absolute best and healthiest thing you can do for your hair. Flat irons and hot combs, like I'm fine with, for not seeing like health diseases from those.
I wonder how much hair loss we're going to have as a result of COVID, but that's my question. There is a question in the chat. Is caffeine good for hair growth? I'm asking because I've seen rosemary oil with caffeine for hair growth.
So the mechanism with hair growth, and unless it's an article that recently came out that I haven't seen, then this is how it works. What caffeine does is it causes your blood vessels to go from nice and wide open to kind of restricted or closed. So that means you don't get as much blood flow. So that means whatever you inject or infuse or what have you doesn't get rinsed away. So the mechanism behind that is to put the rosemary on and lock it in so it doesn't get flushed away so quickly. It causes blood vessels to constrict. I haven't seen much data at all, at least not like robust scientific data that is literally going to the follicle the way that rosemary does, the way that minoxidil does, the way that certain things do, and told the follicle grow hair. I'm not seeing that yet.
Thank you.
Dr. Kindred, I have another question in the chat. Going back to finding chemicals in urine, have we found a similar result with women who have used hair dye or colored their hair?
Yeah, I think that study came out in December of 2019. So in the study, they looked at relaxers and hair dyes, and they looked at breast cancer. The group that reported using darker color hair dyes, which is more common in Blacks, along with the group that used relaxers, there was definitely a higher increase of breast cancer. Now, if we just did this in about 10 patients, 20 patients, 100 patients, 200, maybe not, but I think this study had like 40,000 or something, some ridiculously high number. So if it was a coincidence, it should have evened out. So that means you want to use as natural products as you possibly can. And there are a lot of plant-based hair dyes. So henna is like the gold standard for a natural hair dye. It takes forever to put in. It doesn't last that long and it's super duper inconvenient, but there are places that will do henna. But then there are some that don't add PPD, paraphenylene diamine, into it. And that might be one of the ingredients that we think might be causing a problem. And in the same study, hair products that target Black women had more cancer-causing ingredients, as the hair dyes, than the hair products that target white women. And that particular point has been repeated a few times in different studies.
Yes.
Oh. All right, Dr. Kindred, is it okay if we extend our closure by 15 minutes? Because I still think we should touch on like male pattern hair loss in men, because it's not just women. So are you fine with us extending it for 10 minutes?
No problem.
Okay, thank you so much. Bria, is that okay with you as well? Okay, Arvin, good? All right, thank you. So my question is from the chat. Someone asked this question: is birth control pill, I think OCP, connected to natural, like to hair loss in African American women or women of color?
Yes, it's connected to hair loss in everyone actually. It's kind of how when we were talking about hormones and pregnancy and things like that, it can trigger a telogen effluvium, in which case I would just try to switch to another method. It can happen when you start it. It can also happen when you stop it. It's just one of those possibilities. But it's temporary, right? It was an artificial cause. right? It wasn't like some disease in your body. It was literally a medication you were taking. So come off of it, switch to something else, and move on.
So before we move into the talking about the males, you see me talk to me about gray hair. You know, I mean, I think it's one of the crowning glory of, you know, it looks so great on Black women, right? But we don't get a lot of information about gray hair and really how to take care of gray hair. So I would love to.
Yeah. So, you know, gray hair, some of us look great in it. Some of us look like Oscar the Grouch. It comes out brittle and dry looking and scraggly. Literally for some people, the gray hair is just more brittle. So you have to be a lot more delicate with it. And just because you dyed it didn't make it less brittle, right? But if it's pretty much your natural hair and gray, then you can do whatever you would normally do. But why gray? So if you're graying at the same age that people grayed in your family, you're all good. But if you have premature graying, I highly recommend get your vitamin status checked. So low vitamin B12, for example, can cause premature graying. Any dermatologist would know which labs to check. And that's if it's premature. It would be unreasonable if every person with gray hair who was graying at an age appropriate time came in for lab testing. But if it's unusual, do so. Now,
Right.
if you have that brittle kind of gray, then for that, what we recommend is, well, first off, it breaks with relaxers, like 100%. And I
Right.
think the group recognizes it because they tend to start getting rid of their relaxers at that time. Usually it needs more steam treatments to kind of hydrate it. And usually it has to be moisturized, I don't know, a leave-in conditioner or whatever, and then coat it with some kind of oil. But that's what we do for any kind of brittle hair.
Thank you.
Thank you, Dr. Kindred. Before we talk about male pattern hair loss, what about those who experience graying of the hair in their vaginal area? Should that be of concern, or is that genetic? And should they talk to their mom or their grandmother?
Nothing is safe. It can gray down there too. Right? So with graying hair, what's happening is the same way that our skin runs out of oil and the skin gets drier as we age. It's like the hair follicle ran out of melanin. It ran out of pigment. And that's all it is. So it can happen in eyebrows, eyelashes, pubic area. Nothing is safe from graying if the body wants it to be gray.
Mm-hmm.
Thank you. And so now male pattern hair loss. So I know people have seen, celebrities getting their lineups, like going to a specialist to get new lineups and things like that. So is male pattern hair loss common in Black men? Can it be caused by diet or smoking, just their lifestyle in general? And what are some ways that men can prevent hair loss?
So men, and including Black men, are just as susceptible to CCCA. They tend not to come in, right? So for the men that I have, most of them actually have CCCA, and we're doing injections and shampoos and vitamins and the whole 9 yards as we are with the ladies. It's not like the gene is different. It's still the same gene. But for male pattern hair loss, it's a little bit more straightforward than female pattern hair loss. So male pattern hair loss is the testosterone, it's shrinking the follicles, blocks testosterone, your follicles go back, right? Female pattern hair loss is testosterone plus some other stuff. It's a lot more complex than it. So that's why the men can get away with just Rogaine and keep it going, right? Whereas for women, we got to throw all this fancy stuff at it. But for Black men, I would say don't fall into the trap of just assuming it's male pattern hair loss. Find out if it's CCCA. If you want to save your hair and it's CCCA, you need a medical intervention until the point where you're okay with going bald.
Wow, great point. So my question again is regards to male pattern baldness. How early should a guy seek treatment, or should he just go straight to get the Rogaine?
I'd recommend come straight to a dermatologist that specializes in hair loss, and here's why. If you start Rogaine, you had bet not stop it, right? Like, and that's with emphasis. We've seen people who started and stop it, and they're work. So let me put it this way. Let's say you're here with your hair loss, okay? You start, I don't know, let's say the vitamins that we have, you improve, but had you started minoxidil, you would have improved even more. If you stop the vitamins, you go back to where you were. You stop the minoxidil, you're worse than where you were, right? So I want everyone, men and women, to think long and hard before they run out and start minoxidil, particularly if you don't think you're going to stick with it for the rest of your life. But since there's been so many advances, right? We have so many options now. That's the reason why now I say come to Derm first, so that we can find a regimen that fits you. If it turns out it is just Rogaine, all good. But I can tell you Rogaine that the highest dose is 5%. I have my patients on 12%. It's a lot more effective, right? So if you want that, you probably want the more effective version too, and it's affordable. Some people prefer the pill, and so I prescribe the pill version of it. It requires a prescription. So if you want something cheap, effective, and you're okay with doing it for the rest of your life, yes, you're good with minoxidil over the counter, which is Rogaine. But if that doesn't fit you, come straight to a dermatologist that specializes in hair loss.
So we're planning a road trip up to you, right?
Hey!
So like, you'll need like a week of Boston appointments.
Yes, yes.
We'll set it up.
I'll set those time aside.
Yes. There's a question in the chat. Is it true that we lose hair in the fall?
Some people do. That is a thing. So our philosophy here is, if a patient is telling us they're losing their hair, they're losing their hair, right? What happens is, what's normal for someone else is sometimes that's thin or hair loss for you, right? And when we're talking to, I see it more in women. When we're talking to women, something about that fall leading into winter, there's like this shedding phase, and then by spring we're back on track, and summer, right, we're off fly again. I'm telling you, that is a thing, and we are seeing it in our office, but we take what our patients say very seriously.
Wow, thank you.
Awesome. So my last question for you, Dr. Kindred, before we wrap up is, since people are home due to the pandemic and many people aren't getting their hair done and doing their hair themselves, if someone is in the shower and they're washing their hair and they notice more shedding than usual, should they be concerned? Should they try switching products first before reaching out to a dermatologist? What do you expect? What do you suggest?
Okay. So what's tricky about that is it takes forever to get in to see a dermatologist, right? So if you delay and then you call, especially if you call my office up, I'm telling you now, we're giving you an appointment in March.
Wow.
But we're really anal about hair loss. Like, I literally set aside a full like half hour just to talk about hair on that first visit. And so, I just need time. So what I recommend, if you feel like you have hair loss, it's okay to schedule that appointment, but it has to be with one of us that specializes in hair loss, number one. Number two, if you could count the hairs that came out from the root. If it's breakage, that's a different thing. You do have to change your products. You do have to figure out what kind of damage you're causing to the hair, but you want to look and see. You should see like a little white bulb on it, little ball on it. If that's 100 in a day, you absolutely have a form of hair loss. You need to call and come see us. However, you can have less than 100 and still have a form of hair loss. 100 per day is just a cutoff where we know for sure you have a form of hair loss. Okay. So let's say you count, it's 100 within a day, or I don't know, let's just say it's 95. It's close enough, right? You can at least start some vitamin supplements that's reduced the shedding within 3 months. And there's two that actually work. It's Nutrafol and Viviscal Pro. Nutrafol, Nutrafol, and Viviscal, Viviscal Pro. There's two versions of Viviscal. There's an over-the-counter version and a Pro. The Pro is the one I'm referring to. Within 3 months, you should notice less shedding, for sure. Okay, it's not enough, but at least something while you're at home. These two companies know they're the only two companies that have a legit supplement for hair loss, so they charge $80 for a bunch of, I think it's like 100 if you get it online, but if you go to one of us that's a hair geek, it should be about $80 or so. And then shampoos that contain either ketoconazole, that'll be called Nizoral, shampoos that contain selenium sulfide, so that's Selsun Blue, a little bit too harsh for black hair, shampoos that contain zinc pyrithione, that's Head and Shoulders. You want to use the Head and Shoulders that has the conditioner in it because it's otherwise too harsh in black hair. Just a little bit, they help. So those are some things you can do at home until you come in. And then on top of that, so in my office, if someone comes in, no one's going to make an appointment with us that does not have hair loss and tell us they have hair loss, right? Like, people don't do that. But we still use something using artificial intelligence that allows us to blow up the follicle. So literally we see the follicles. We can see if in a follicle there's 1, 2, or 3 hairs growing out of it. We can see how many are miniaturized, how many follicles aren't even making a hair, right? And we can literally, it calculates the diameter and it gives us a score. That score also helps us to know, because we want you to come in early, but sometimes you come in early, you don't look like you're thinning. That score helps us to know if you're dealing with hair loss. And then, as you know, if you're in my office, we're going to make sure. So we're going to schedule you for a biopsy. So 1, count the hairs, the ones coming out the bulb. 2, you can use one of those over-the-counter shampoo. 3, you can use one of those supplements. 4, you should have already made that appointment for the dermatologist because it's going to take you like 3, 4, 5, 6 months to come in to see us.
Wow. Thank you so much again for your tips and being here today. So I have a final question, and then I'm going to hand it back to Bria to do the wrap up and to talk more about Love Your Menses. My final question to you is, there's a woman out there, she does not want to use chemicals on her hair, but she cannot because her hair is so dense, she doesn't know how to manage it. And she doesn't like the way her hair looks. So as a dermatologist, as a strong woman of color, as a mother, and as an influencer, what would you say to that child or woman that says, I know the chemicals are bad. I've heard from you that it's ingested systemically and it's in my urine, but I don't like my hair natural. How could I go about starting to change? So what's your take on that?
So now we're talking about a psychosocial cultural issue, right? So it's, and that's something where I need more psychologists to help with it, because you know you're doing something bad, but it's not quite an addiction. So insurance is never going to help us with this. So I would like for that person to identify specifically what it is, right? Sometimes we like how, when our hair is down, how it frames our face. Okay, it's something about when it frames our face, how we look. So we're not saying you have to wear updo, you have to cut all your hair off or anything like that. You need to find a natural hairstylist that can do that, that can give you that look. Maybe you want sister locks or dreadlocks, whatever. That's one thing. Sometimes it's because the society that woman is in, that micro society, men don't like women with natural hair, and she's single. we have to admit that's actually one of it, right? They want to look attractive to the opposite or same sex. This is things that we found out in our office when someone finally switched over. Thirdly, sometimes they are in an environment where the work environment, where their hair, their voice, their look needs to be white.
Yes.
Right. And that's her income. And so that's hard. And I understand that. So if it's something within what you can change, please change it, because we want you healthy, sis, right? If you can't, we understand it. So if you're in an environment, particularly if you're under oppression, right? If you're in an impressive environment, especially at work, you don't have the power to just be bold and wear your hair natural, right? I own my own practice. Who's gonna fire me? Not everybody's in that position.
Exactly.
Then at least delay how often you get the relaxer. Preferably switch over to a flat iron or thermal straightening with the hot comb. If it's not something like that where it's affecting your livelihood, I hope it's just as simple as you haven't found a natural hairstylist that can get you the style that gets that you like. I hope that's all it is. Outside of that, you really have to look at how much you've been sucked into the lie that everything white is better. Right? You're gonna have to look into that. The same way, yeah, let me stop. Yeah, you're gonna have to look into that.
Wow. I wish we can just keep this conversation going. Dr. Kindred, you really need your own TV show. Because
Yes.
you just have a plethora of knowledge, and this is also important. And I feel like every time we have a conversation, I'm just thinking of, okay, what could we do next? And so I'm definitely going to follow up about that grant for hairstylists, because it's so needed.
Yeah.
So thank you so much for this conversation. Everyone, please join us for part 3. At the end of our 3-part series on November 19th with Dr. Kindred. So please come prepared to have your questions answered. And there'll be another topic that we will be discussing at that time. Thank you so much, Dr. Kindred. We appreciate you, we love you, and thank you for spending this hour with us. Thank you, Barry and Irvine, for joining me in this discussion. Everyone, please continue to follow us. Yes, please follow Love Your Menses on social media. Check out our website, loveyourmenses.com, to stay up to date on things that we're working on. Thank you all, and have a good night.
Good night.